Welcome back. Many people are taking multiple medications these days. When you add vitamins and supplements into the mix, it can get pretty complicated. That's why Essentia Health offers medication therapy management services. It's a chance to sit down with a pharmacist and discuss what you're taking. We're joined now by Richard Mullvain, who specializes in heart medications. And thank you very much for joining us this evening. First, could you explain a little bit about what is medication therapy management and how does it help the patients?
It's a chance for the patient to sit down with the pharmacist, look at everything they're taking, all of the medications that have been prescribed by possibly several doctors, and on top of that, vitamins and supplements, look for drug interactions and essentially what we call drug therapy problems, and then intervene on the patient's behalf to help resolve those, rather than say, you know, maybe you should ask your doctor about it. I will talk to your doctor about it and see if we can't fix it.
Have you had any surprises where people actually bring shopping bags of medications in?
That's kind of the cliche, is a grocery bag full of supplements and vitamins and prescription drugs. And it literally can be like that for some people. They're on so many things. And it does take a lot of effort to sit down and go through them. And maybe in the past, the doctors don't always quite have the time to do that. And so this is where the pharmacist can really get involved and really start to put this together.
So on one hand, you have the prescribed medications, but oftentimes people might see advertisements and magazine articles, go through the aisles in the grocery store, see all those vitamins, and they might start supplementing their diets with those. And what's the problem with that?
Well, there can be a couple of problems. First of all, when we ask somebody, what are you taking, we have a list, and then sometimes we have to say, well, what else are you taking? Oh, you mean these, you know, some people don't identify supplements and vitamins as medications, and they certainly have the potential to interact with other medications. And not that there's anything wrong with taking some of them, but we need to know about them so that we can check them out and look for the problems.
Mm-hmm. What are some of the most common vitamins that patients take?
Well, as you just heard from Dr. Slag, vitamin D seems to be a very popular one. Vitamin C is somewhat popular this time of year because people, you know, still feel that it wards off colds and things like that. But as a whole, a lot of vitamins have really fallen by the wayside. People really used to like vitamin E. It was the heart vitamin. And now research has showed that the more vitamin E you take, actually the worse off you are. So it kind of goes back and forth.
It can be so confusing, especially for us consumers. Mm-hmm. Why is it important to talk to a pharmacist about interactions between supplementation and your medications?
Well, again, I'm in the cardiology area, and I've seen many, you know, heart interactions that can happen. Certain supplements can have. Well, nowadays it's more scary because some of the ingredients are listed as a root, but not necessarily the chemical. And so it may be like a bitter orange, but it might be the building block for something is known as synephrine, and it can speed up your heart. It can affect the heart rhythm. And then a lot of these things also can have a serious effect on the way your blood clots or how thin your blood is.
Do you think the typical consumer, if we see it over the counter, we think it's relatively safe and there should be no problems with it?
Yeah, if it's all natural, it's all safe. It's hard not to almost joke about that because it's a very serious issue. But certainly just because it's natural doesn't mean it's going to be 100% safe to take. It may be safe, but it's very important to get it checked out.
Mm-hmm. Do you have some specific examples that patients should be aware of as far as vitamin E and vitamin K issues like you were mentioning earlier about blood thinners?
Sure. Vitamin E has a lot of issues around it, but ultimately we like to recommend no more than 100 units of vitamin E a day. If you're taking 400 or 800, 1,000, or some people are taking 2,000 a day, that can actually affect another blood thinner known as Coumadin or warfarin. It can cause some other problems, as well as other supplements that may have hidden sources of vitamin K. K is our clotting vitamin, and if somebody is on a blood thinner, that can really throw off the balance there. And,
sure.
we may not be aware of it.
Sure. And it's not just those bottles that we pick up in the aisles. A lot of us take energy drinks now with vitamins. Can they have other ingredients that aren't possibly
Yes.
too good for our hearts.
Absolutely. The energy drinks are very frightening in a way because, again, it's a food product. It's not really, you may not know everything that's included, and there are lots of essentially stimulants, caffeine. Now, ephedra is supposed to be illegal, although sometimes you can find sources of it, especially when you can buy these things over the internet right now. And then a lot of them do contain ingredients that are stimulants that for some people could be very harmful to their heart.
Sure, and a lot of our young people are using those energy drinks just to
Yes.
get through their school days, and if they have a couple of caffeine drinks or a cup of caffeine cups of coffee, they could be in for some trouble.
Yeah, it can be trouble.
Any other ingredients that we should be keeping in mind that we should probably steer clear of?
Well, as far as ingredients go, it's very important, I think, to buy products that are made in America because you can actually see more so what the ingredients are. And this is really a new problem that people can buy things over the internet much easier and they can be imported from other countries and they may have masked or disguised what actual ingredients are in there. So in general, I recommend you get products that are made in this country.
Mm-hmm, mm-hmm. Any quality seals or something like that, they could be a consumer guide for us?
That's a great question. In fact, there's a special mark that I look for. It's called USP. It's a little green circle thing that says USP, and it stands for United States Pharmacopoeia. And manufacturers can voluntarily submit their products for good manufacturing processes, purity, and if they do that, then they do get that seal. And I recommend, if you're going to buy vitamins and supplements, that you buy products that have that mark on them.
Great. We'll look for the seal. And thank you very much for your time. Some wonderful information.
And if I could just add one more thing in regards to the vitamin D. Again, that is a fat-soluble vitamin. So one of our tips is actually to have patients take that with the highest fat content meal of the day, and that usually is the evening meal. So I just wanted to throw that in there.
A little more bang for your buck.
Maybe.
Okay. Thank you very much. And coming up, one of the best ways to get the vitamins we need is through the foods we eat. We'll talk to a dietitian about a concept called food synergy, eating the right combinations of foods to get the most health benefits. And she'll share a recipe for a vitamin-packed soup that's delicious and easy to make. Stay with us. We'll be right back.